I met a sweet young horse at Shiloh Equestrian Center in Golden, Colorado. She was 3 years old, and for the sake of the owners, we will call her Lucky. Lucky was found lying down in her pen in a lot of pain. Today we're going to share with you the case of Lucky and her bout of colic.
Colic is a term used for any pain caused in the abdomen. It is very common in horses and can mean a variety of things, from gas in their stomach to a complete obstruction in their GI tract. Some critical symptoms of colic in horses include noticeable pain, sweating, panting, urinating at an awkward stance, spinning, rolling, and no noticeable bowel movements. In the diagnosis of colic in a horse, a complete physical evaluation is critical.
This was not Lucky's first colic. She showed symptoms of abdominal pain 3 different times in 1 month. Dr. Toll and the owners tried several different approaches to her case. They first looked for stomach ulcers, then they thought sand colic may have been the issue.
The diagnosis of a possible stomach ulcer consisted of an endoscopy. This is when a tube is placed down the esophagus into the stomach to view the stomach lining. In Lucky's case, there were no ulcers.
Another form of colic is sand colic, where sand accumulates and blocks or partially blocks part of the GI tract. To diagnose this form of colic, a veterinarian or a veterinarian technician must do a fecal analysis to see if there is sand in the fecal matter. Treatment of this form of colic usually requires surgery.
In Lucky's case, with an exploratory laparoscopy surgery, she was found to have a form of strangulation colic. She had a large right dorsal colon displacement, where her right dorsal colon was vertical instead of the usual cranial to caudal placement.
When they found what was causing the problem, they took Lucky into immediate abdominal surgery. For pre-op, they possibly administered a polyionic isotonic IV fluid, flunixin megelamine for pain management, and an antimicrobial like cefalozolin. They also probably used isoflurane for anesthesia. The team placed her in dorsal recumbency and shaved and cleaned aseptically the surgical site on the abdomen. Once they had Lucky ready to go into surgery, they proceeded quickly so they could stop the mesentery and intestine from becoming necrotic. They may have had to do a resection and anastomosis if there was any necrosis.
After the veterinarian and his or her assistants placed the organs and intestines in their correct positions, they proceeded to close Lucky up. They may have closed the linea alba with stainless steel wire number 3 size, with a simple interrupted suture. The second layer was possibly closed with an absorbable chromic gut-aught suture. The skin was closed with a monofilament, non-absorbable polyurethane-aught suture.
Post-operatively, the veterinary team potentially placed a nasogastric tube to make sure that there was no problems in the stomach. They also possibly placed an abdominal bandage to prevent the surgical site from contamination or infection after the surgery, and may have had to provide her owner with ketoprofen or xylazine for abdominal pain.
The suture was removed 14 days after surgery to allow for healing time. The stitches were protruding out of the suture site in 3 areas to allow easy removal. Dr. Toll cut on both sides of the suture site and pulled down to release the suture. There was a little edema in the suture site, but left it to see if it would go away.
Dr. Toll stated that it would be 3 months before her abdomen was half its strength. She would have to be watched on what she eats so as not to overload her body systems as well as causing another colic.
All in all, Lucky has a while before she returns back to her normal state, but she is lucky.
She put the lime in the coconut, she drank 'em all up. She put the lime in the coconut, she called the doctor, woke him up and said, "Doctor, ain't there nothing I can take?" I said, "Doctor,